on here, Ragali? What's going on?
Bring it, Norm. Bring it.
Test, test. Can you hear me?
Yes.
Yes, I am Dr. Bennett. I've been in private practice for 32 years, 31 of them right here in downtown Libertyville, and I just love what I do. I'm a second-generation chiropractor. Living with a dad who was a chiropractor, I got to see a lot of amazing things he did to help people, and myself included. And when it came time for me to get serious about what I'm going to do with my life, what I can be passionate about, what would get me up in the morning ready to get into work, there just really was no second choice for me. So I want to show you an illustration about why, come on up, Cody, why chiropractic care makes so much sense for me. Cody has a problem. He just shut his finger in the door, and it's locked. So he calls me up and says, Doc, what do I do? Well, I look at his finger and I say, well, it's really inflamed. So let's get you some heavy-duty anti-inflammatory drugs and knock that inflammation out of there.
Really?
And he looks like he's in a lot of pain too, doesn't he? So I tell him, let's get you some Vicodin, and we'll knock that pain out of there. Call me in 2 weeks if you're still having trouble. Well, of course he's still having trouble. So I tell him we can do a cortisone shot in that finger and really knock that pain out of there. And sometimes one doesn't work, so you have to have a series of 3. But don't worry, if that doesn't work, we can always do surgery and get rid of that finger altogether.
I don't know where this is going, but run.
Now that's ridiculous, right? Of course it is. None of those things are going to fix what's causing Cody's problem. Opening the door will.
Get rid of the door.
Right. Opening the door will, thanks Cody. And then his body will heal up that finger all by itself. This is why I'm a chiropractor. I get to open the door to fix causes, not just treat symptoms. Now, I hear this story every day. People who have back pain or neck pain go to doctors who, by and large, treat the symptom and not the cause. We live in a drugs-first culture, don't we? These opioid drugs, like Vicodin, have their own addiction programs that compete with each other for your business, that is covered by insurance. So there's something wrong here. This article says there are 9 major manufacturers of opioids, drugs that have been overmarketed to the point that, quote, in 2009, there were more than twice as many deaths from prescription opioid overdoses than from cocaine and heroin put together. Wow. So not only does it not fix what's causing the problem, there are dangerous side effects to go that route. So why would chiropractic be important in fixing causes? What is chiropractic anyway? Everyone has a picture of it in their own minds, but is chiropractic massaging the back? Is it hot and cold packs or muscle stim therapy? Is it acupuncture? Is it prescription orthotics for your shoes, for your feet? Is it rehab exercises? Is it diet counseling? All of these things are good. But I refer these things out to the experts, like Dr. J and Kevin. What sets chiropractic apart, what we do that no one else has the training or expertise or license to do, is expert spinal manipulation. Now, Joy, statistics show that 80% of people are going to have back pain at some point in their lives. That's 4 out of 5 of us in this room. Many published medical research journals now show that in people with back pain, spinal manipulation is the first choice of treatment, and surgery is the last resort. So why spinal manipulation? Because it opens the door. It gets rid of what's causing the pain instead of covering it up. Now this is a little tiny model of the spine, but I want to show you how spines work. If you have a spine, sometime today, one or more of the joints are going to lock up, and later they're going to unlock and move again. That's how we're built. That's how we're designed. Otherwise we break with all the stresses we put on our bodies. But sometimes, with repetitive postures we get in, or repetitive movements we do, or the repetitive stress we put on ourselves day after day, some of these joints can lock up and stay locked up and get past the point of your body unlocking it by itself. And when that happens, it may not hurt right away. It may not hurt for months, but the longer that stays locked up, the more the nerves that come out in between the bones get twisted and stretched. And if you twist and stretch nerves long enough, you're going to eventually reach your pain threshold and feel symptoms. A lot of times it's as simple as I just reached for my coffee and my back went out. Well, that's a last straw. Your coffee doesn't do that. Or it could be building up over a period of time, getting worse and worse, and you hope it goes away and it doesn't. If you're irritating a nerve that leads down the leg, you're going to feel it down the leg, sciatica. If you're irritating nerves that lead into your head, you're going to feel it in your head. Headaches. Major cause of headaches is locked up joints in the spine, irritating nerves. The solution is spinal manipulation to get the joint functioning normally and get the pressure off of that nerve. Now, it's not that a bone went out of place and we're going to shove it back in place. That's not the model. The model is the joint's locked up. We find out where it's locked up, how to unlock it, get it unlocked, and let it heal up all by itself. Patients tell me their doctor said arthritis is causing my back pain, or bulging disc is causing my neck pain. But we treat these people, we get the joints unlocked, get the nerves to heal up, and their pain goes away. So clearly the arthritis or the bulging disc isn't what was causing their pain. So people ask me, how do you know who to adjust? How do you know where to adjust? Well, I'm going to show you all of that. After 32 years, I'm an expert at spinal manipulation. Remember Malcolm Gladwell's book, Outliers? He talks about the 10,000 hour rule, 10,000 hours of focused practice to develop elite skills. I have over 30,000 hours in focused practice in spinal manipulation, so I'm pretty good at it by now. So I'm going to show you how I know what to do. Rock's going to get on the table in a second. We use, hang on just a second. We use the most well-researched and validated adjusting method in chiropractic. It's called the activator method. 46 years ago, this was a breakthrough in spinal manipulation. No popping or cracking, no twisting or using my weight on people, no having to put a gown on to get treatment. The big part of it, one part of this is the instrument. This instrument called the activator moves the spine with such a high degree of accuracy that it's FDA approved. But it's not just the instrument that makes a difference. We all know that owning a good hammer doesn't make you an expert carpenter. It's the method of using this that sets this kind of spinal manipulation apart from other adjusting methods. This is what I'm an expert in. Go ahead and lie down. Now, I know Rock's spine, so I'm not going to go through everything, but we test a person's reflexes in a highly fine-tuned series of checks to determine when to adjust, where to adjust, and when to stop adjusting. So there's no guesswork. Scoot over to your left a little bit. When you're off your feet and everything's relaxed, and I bend your legs up, your heels are supposed to look even. I don't know if any of you can see that, but it's pretty clear his legs are even. When we test different levels of the spine by having him move in certain ways, it's testing reflexes. If he's testing a level that is moving freely, his legs will stay even. We test something that's locked up and needs to be adjusted, his legs will shift. So put your right hand behind your back, Rock. So that's a test for the lowest level in the spine. It's even. Put both hands behind your back. Now, can you see that shift? Yeah. His legs shifted. You can't fake it. You can't hide it. Put your hands down. That's telling me this level of his spine is locked up and needs to be adjusted. So when I adjust it, and that's what it looks like, Put both hands behind your back, we'll test the same thing again. Now his legs are even, there's no guesswork.
Wow.
You can get up, Bob. So,
You put that on the side of his head. Leave the medical advice.
that would be guesswork. Now, many of you in this room are patients at my office, I won't point you out, but if you want to get your checkup today on me, I'm going to be in the London room at 8:30, and we can show people how a full adjustment works. It takes 2 minutes, 3 minutes to adjust somebody. I'd be happy to demonstrate that in there. We do treatment plans for each specific person, depending on their problems. It includes home exercise. Once their spine functions normally, we release them from care and recommend that they continue to exercise on their own. Many of my patients come in for prevention checkups because they want to keep their spine functioning. So, bottom line, my patients don't want just an adjustment. They want relief, yes, but they want to function better. They want to work better, sleep better, they want to perform better, and they want hope. My mission, my why, what I live to give is this, is hope for people. So again, I'll be in the London room at 8:30. If you have any questions about anything, I'd be happy to talk to you then. Thank you.